Hello everybody and welcome. I hope you're well. But today we're going to talk about high blood pressure, or most commonly known as hypertension. This new pandemic, I will call it, because we all know at least one person in our family which has hypertension. This is getting bigger and bigger every year. More and more people having hypertension. And it's not for any reason that when you go to the doctor's office, the first question they will ask you is if you have any history of hypertension in your family, or maybe diabetes also. They ask you this because if you do have any family members in your family with hypertension, it's a big risk that you may as well have hypertension in the near future. But like I always say, nothing is hereditary. What is hereditary is our beliefs or our family beliefs, those beliefs that are passing by generations and generations. And for that reason, we all share the same disease. It's for that reason as well that some people may have it, but some people in that family may not have it, because those people don't have the same beliefs that those with the same disease will have. Now, one thing that we do agree with doctors, which I love doctors, I love every doctor, but I don't agree with doctors because they treat the symptom only. So when you take a pill for one symptom, they don't go to the root cause of what is causing that symptom, and that pill will cause another problems, and then you have many problems, but when all started with one thing. And that is because they're not treating the root cause of what's going on behind that person. Now, when we talk about when we talk about hypertension, with the doctors, we do agree that it normally is related to stress. Now, in this video, you're gonna learn what are those emotions, deep-rooted emotions that are causing that stress, and for that reason, you have hypertension. Now, when we talk about hypertension, we are talking about the heart. And when we talk about the heart, we are talking about the house. What I believe is my house, my home, the conflicts inside my house. When we have any problems in our heart, we have big conflicts in our house, in our home. Now, also, we're talking about blood. And when we talk about blood, we are talking about family, my blood, my family, those family ties that we have. So when it's any disease or any problems with blood, we having conflicts with our family, and we need to look at what's going on with my family that it's causing me this disease. Now, also in the high blood pressure, we have conflicts in our ventricles. And when we have conflicts in our ventricles, we're talking about the masculine, conflicts with something in the masculine side. Now, also, the atrium is related to hypertension, and the atrium refers to the feminine. Now, when we have hypertension, we have big, deep-rooted conflicts with the family, with my family members, with the mechanics of this family. It's a big devaluation inside my family. And people with hypertension truly feel that sometimes, or all the times, is somebody in that family that it's making a lot of noise, like I like to say. It's bothering. Now, people with hypertension are very territorial people. And what do I mean by that? I like always say, territory is everything that I consider mine. My house, my dog, my car, my job, my house, my husband, my wife, everything that I consider mine. So people with hypertension are people that are very, very territorial people. Now, it's a big difference depends on what kind of blood pressure, high blood pressure you have. It may happen that you have the systolic blood or your diastolic one. So today we're going to talk about both of them. So when somebody has high the systolic pressure, this person is having issues with conflicts direct in the family, where the person feels that it's too many people in that house, too many people on my heart, too much blood in my heart. People with high systolic pressure are people that feel that it's a bit too much in that house. Now, because of the systolic pressure, we also relate with the ventricles. And when we have conflicts with the ventricles, we talking about what I said before about the masculine, and it's like that part that is pushing and pushing to get somebody out of the house, somebody out of that heart. Now, that's when it's a conflict there with the atrium. And the atrium is in a way saying, hey, hold on, let's hold this. So people with high systolic pressure are people where they feel that it's too many people, too much family in that house, but they want to get them out. But sometimes it's even with people that passed away. So you have to see if your high systolic pressure started with somebody passed away, it's because unconsciously is a way to say, I want to retain this person that just passed. I didn't want them to go, so I just want to retain it. Now, I'm going to tell you a couple conflicts that you normally find on people with high systolic pressure. So it will be something like, I have in my house at the moment, my son and my daughter-in-law living in my house, but I just find this a bit too much. I feel that my house is not my house anymore. I want to kick them out. But unfortunately, I feel that if I kick them out, my son is not going to talk to me anymore. Or I want to kick them out, but I feel that if I do that, I'm not going to see my grandkids anymore. So I'm having this pressure building on me, but I can't kick them out. Or I want to divorce, but I just can't for some reason, but I really want to do it, but I just can't. Or I have a husband that it's a bit violent, a bit abusive. I want to kick them out. I want to kick him out, but I feel that if I do that, my kids may not love me anymore. It's just conflicts with, I want to kick somebody out, I want to get that out of me, but I can't. So that's when the pressure builds. Now, when the problem is because the diastolic pressure is high, now it's a bit of a different conflict, because there is a problem where I want to retain somebody. I want somebody to come back to me. Somebody could be, I had already a separation with somebody, and I feel that now in this relationship I feel like I'm gonna lose them also, so I want to retain it. Like I said before, people with high blood pressure are territorial. They want to retain that, and I feel out of control. They feel that they can retain that. Now, when we talk about high diastolic pressure, we're also talking about the atrium. And like I said before, atrium is to do related with the feminine, but also in the atrium is this little valve that it's there. This little valve for people represents freedom. And people with high diastolic pressure feel that they are waiting for a miracle, for something that will set them free. So, conflicts that you may find, for example, in people with high diastolic pressure will be people that feel very devalued in the family. They don't feel appreciated in that family. There are people maybe where they have lost their territory. So let's say I had a business, and my son now decided that he wants to take over my business. I feel under pressure because I feel that's my business. I can still deal with my business, but my son wants to take over, and I feel under pressure for that. And I want my freedom. I want to be able to say, no, hold on a minute. That is my business. That's my house. That's my car. People with high diastolic pressure will have this kind of conflicts of building so much pressure up because they're not able to say what they truly want to say. They want to say it, but they can't. And they feel trapped in their own body because they're not able to set themselves free and say, hey, this is what's bothering me. You are bothering me. You are not appreciating what I do. You're not really valuing what I do for you. These people also feel that there is too many people around them, too many people taking decisions for them, doing orders. They feel under order, they feel under pressure because they just feel that everybody is taking over them. And that's when that little vowel says, this is your freedom and you should take it. But they're not able to do it. Now, sometimes people have the systolic pressure high or the diastolic pressure high. Sometimes they have both of them. So we need to look to see which one is your conflict. But most of the time is that I want to kick somebody out, but I'm not being able. I'm not being able because I feel I may lose my family. And that's what the territory comes. That's what they saw territory. If I actually say what I truly feel about what's going on around me, I may lose my family and I may end up without family. Now with preeclampsia, since we're talking about high blood pressure, with preeclampsia, the woman is feeling that they are worried. They're maybe not being able to bring somebody inside the house, like this new baby. So they may be worried because they may worry that they don't have enough money, or how they gonna do now when this baby comes. How am I gonna deal with this? These women sometimes feel pressure in the job or inside the house also, where they feel, now I'm pregnant, but now I have all these big issues around me. Also with preeclampsia, we need to look for those family histories of those women that have they had lost babies in childbirth, because for them unconsciously represents, if I give birth, I may not be able to kick that baby out of the house, because already I had maybe my grandmother or my auntie that passed away on childbirth. So with preeclampsia, we always have to look for those conflicts. I hope this video has helped you to understand your high blood pressure, your hypertension. And like I always say, please take care of yourself, invest in yourself, and try to heal yourself so you won't be passing your disease to your family members. Take care, and until next video, bye-bye.